Hello, everyone. Dr. Kelley, and I am here to talk to you about a question that I was asked recently. So this is the I Care About Health IT podcast. And a few weeks ago, someone that I was talking to had asked me about how I got started in health IT, how I got started in informatics, and also how to grow in the field, and not necessarily in the formalized way, but in the indirect, informal way. So I thought I'd talk about that a little bit today. And my interest in health IT was really not something that I anticipated, if that makes any sense. I'm sure it will as we continue on with this episode. But I was working in clinical care, clinical direct care, and really looking for a change and looking for something different. I didn't really know what that was. So I was about three and a half years into my nursing career, and just knew that there was something else I wanted to do, but I didn't really know what that meant. And so we're going back 20 years now. And so 20 years ago, the accessibility of the internet was not what it is today, as was accessibility of different programs. So I ended up doing two different things. One of them was finding a role as a case manager at Blue Cross and Blue Shield that was located in Quincy, Massachusetts. So I'm located in Boston now. I've lived all over, but I've been in Boston for the last 10 years. And in that role, I was looking for some regularity in hours. I was looking to, step away from night shift and rotations and things of that nature that I found to be a little bit disruptive to my schedule, my life, things that were going on. And so ended up finding this case manager role and was in it for about a year and a half. But during that time, one of the areas, my team where we were sitting, I wasn't the leader of the team, but there were several people on my team that we all sat in this little area. And the clinical trainer for the new clinical information system was the only person on her team. And so she had a spot right in front of us. And we used to talk a lot about making this transition from a DOS-based system that we were using to this web-based system. And at the time, I knew very little about health IT, but I found it interesting what we were talking about. And it was also, there was an opportunity for us to be able to create this new clinical assessment. And somehow I was volunteered for this activity and this role to help design this clinical information system assessment. And I didn't really think much of it at the time. I just thought, okay, this sounds interesting. I can do this. And creating the fields, creating the workflows, meeting with the other care managers and talking about this was all in addition to my regular responsibilities. And probably, I don't know, I can't remember exactly. It might have been 6 months later, I started to think about sort of exploring other career opportunities. And I didn't really make the connection to that interest and what my next role was until, probably years later. But I ended up pursuing a role at Boston Children's Hospital as a clinical analyst on their, the term that we used was Children's Hospitals Applications Maximizing Patient Safety. So CHAMPS was the name of the project. And again, I came from very little health IT informatics background. I didn't even know the word informatics was a thing at the time. But I knew I missed at the time working closer towards a hospital setting. I had colleagues that were in these roles that seemed to enjoy them. And I thought I would give it a shot. And so I ended up on the orders team, and my expertise in clinical care and clinical workflow, because I'd worked as a travel nurse in their cardiac step down unit for a couple of years, was of interest. So I ended up in this role, not really knowing what I was going to be doing, not really knowing what exactly it was going to entail, and having a very naive perspective on how complicated it would be to digitize patient records. Perhaps it was good for me to have that naiveness, because I'm not sure if I thought it was as complicated as it was, I would have felt comfortable even applying for the role. So in some cases, having that gumption to go for something when you don't really know what's entailing it can be somewhat protective and beneficial. So that story I've told many times, but the story that came about, that was sort of peeling behind the layers of, how did I grow and how did I develop further, like really starting from no formal training and developing that interest and skill set and knowledge, etc. And my response to this was that a few things. One, my personality is to ask a lot of questions, and if you know me, you've probably seen this with me, is I ask a lot of questions, really to anybody. It's for my own understanding, to understand what we're talking about a little bit further. And it's like, really trying to get at the layers that constitute something. And so the questions are there to give me the information I need to be able to answer that question in my mind and move to the next thing, which may stimulate another question. I don't know. Depends on what I asked. So the questions were helpful because it gave me more insight as far as why we're doing what we're doing. So questioning, I always ask a lot of questions. And the second thing that I said was that I look to learn from other people, and that people that know more than me. And so I was on a team where we had several different individuals that had been through implementations before. Most of the nurses that were on this project, this was their first electronic health record implementation. Most of them, maybe not all of them, but many. But for the IT professionals that were coming from the, IT analyst or IT perspective, those individuals typically had been through an implementation before, or many. And so by nature of how the teams were constructed, there were clinical and technical individuals on part of the team. So I learned a lot from the people that I worked with. Sometimes actively asking these questions, sometimes passively, and just sort of listening in meetings and hearing what they're talking about. I remember the first time I heard us talking about code, and it was in a big meeting, and I was pretty new to this role, and I was like, that's obviously not a clinical code. So this is something new for me, right? So just even that, to think about how the nuances of a word can mean different things between different disciplines, does require your attention. It requires you to be listening, asking questions, not being afraid to ask questions, and showing a genuine interest. I think, there's a difference between doing the job per se and doing it with intent and sort of striving for more or striving for better, whatever that means. It doesn't necessarily have to mean something specific, but you usually can tell in yourself. I know I can tell when I'm able to sort of do something even better than I had initially intended, right? There's this sort of instinct that you have of like wanting to make it better, or make it even more improved than it was, or how to satisfy someone's request in a different way that you haven't been able to before. Like those sort of reaching efforts are important. So asking questions, really learning from people that know more than you around you, And I would also say there's a lot to be learned from just being an active listener. And that means, in the meetings that you're attending, whether they're in person or virtually, like listen to what people are talking about and listen to how they're reacting to what's being presented. Listen to their concerns, listen to who's not talking. Why aren't they talking? Are they okay with what's happening, or maybe they don't feel comfortable speaking up? Like paying attention to everything that's happening is going to be informative, because you'll not only learn like the topic that's being discussed, but the issues that are surrounding it that may not be the easiest to talk about, or may not be something that is going to be able to be solved in an hour. So maybe people strive to like just put it aside for a particular session, whatever it might be. So those efforts in its own right, I mean, we're talking about it from a health IT perspective, but these aren't unique to health IT or informatics. They're really skills that you can apply for anything. And I think, for anybody that might be thinking about making, it's not even necessarily a career transition, but growth in your career, having that recognition within yourself of knowing, okay, I want to strive for this. And sometimes somebody's not behind you saying like, you really should be going for this and you should, tapping you on the shoulder. I would say more often than not, it's going to be you who's going to be thinking about, well, what should I be working towards next? And how am I going to get there? And so in this role that I was in, right, there wasn't necessarily a lot of formal education or training around what we were doing. It was really on the job. And, again, going back 20 years, the knowledge around informatics and what we know today was there. The field's been around since the 70s, but the intricacies of nursing in electronic health record development was not as well known as it is today. We didn't have the science that we have today. So in many ways, there's on the job training that folks will go through, but it's also up to you to participate in that effort. And, just being actively engaged. And engagement doesn't necessarily mean you have to be talking. It just means you have to be involved and listening and responding and hearing what people are saying and demonstrating that they're being heard, and asking for more. Sometimes it's a matter of, if you feel like you're looking for more of a challenge. I remember there was a time when we had transitioned from the project status to one of maintenance, and I didn't really love that transition period as much as I liked the project-based work. And so I started to look for, well, what else can I be working on, or what else could I be involved in? And recognizing that own growth within myself. And that is something that I think people need to pay attention to, in the sense of recognizing when you're feeling inclined to do more or seek out more. So asking a lot of questions, being open to opportunities or responsibilities that may not seem like they match exactly where you're at, but someone else is seeing that you're capable of it. Actively engaged and listening, and really turning to those people that know more than you do about what you're working on, and take in what they're willing to share with you and incorporate it. And you'll be that for other people as well. For our IT professionals, they did not have clinical backgrounds. And so they were always asking us clinical questions. And at times it probably felt like the answers changed day to day, but we did our best to try to explain how certain things would happen in a clinical care setting, and why it would seem one way and be exactly the opposite in another. And that, as you know, if you're a clinician listening to this, that's not easily replaceable knowledge. So people are going to be looking to you for that expertise as well. So those are my thoughts around that indirect activities to grow in a new field, in this case, health IT and informatics, but it really could apply to anything. If you've got questions, let me know. I hope that was helpful to some degree, and we'll see you next time. Take care.